Patients have a history before they ever come here. They're a person, they had their life, they're living their life, and then they get this diagnosis, which causes a lot of chaos and change for patients and families. That's where we come in, and we do provide things like counseling. We have a fancy word we call psychosocial oncology. So as social workers, we've been highly trained in the unique needs of the cancer patient and how to best support them through their journey.
It's a very good idea to bring someone with you because so often you don't register everything that is being told to you.
I find often even when I'm talking to a patient, and as soon as I say I'm recommending chemotherapy, the patient will shut off, and I have to speak with the family members after that. The patient cannot listen anymore because their mind, and you can see their mind racing off on a number of different tangents.
I often would go home and my husband would say, she said this or that, and I'd say, wow, I didn't hear that. So it's really, really important.
Some of the commonly asked questions that I do get, number one is, what should my diet look like now that I have cancer or I'm undergoing treatment? Basically, the most important thing is that you're following a healthy, well-balanced diet. Our goal is to maintain your quality of life, minimize any weight loss, and keep you as healthy as we possibly can through your journey through the cancer clinic. On your first appointment, the dietitian will sit down with you, we'll get a weight history, and we'll get an idea of what you're able to eat and drink in a typical day. And then from there, we'll build on that depending on what you're experiencing at the present time. Many times, patients will minimize their symptoms because they don't want to bother anyone with what they feel are minor problems, but really those ESAS scores tell the healthcare professional quite a bit about what's going on, and then will help us help the patient better.
And also, of course, the Cancer Center has learning resource centers within our building, and that really enables the patients a place to go, and they can actually access the internet. There's links to approved cancer websites, and basically the whole goal is to provide information for patients that want additional information.
Our pharmacy department is located on the first level, where patients are able to drop off the prescription their physician writes, and we can go ahead and fill those medications for our patients. There's so many different chemotherapy regimens out there, so you have to have a pharmacist knowledgeable in that area in order to minimize the fears or concerns that patients may have. A lot of the medications sometimes tend to be expensive, so we usually always ensure that somehow the medication gets covered, either through private insurance plans, or if a patient does not have private insurance, we tend to look at other options.
That's what patients' biggest desire to do, is to go back to who they were before all this happened. And the reality is that you can't go back. The reality is that your life has been forever changed by this because of what cancer is.
Your life becomes, it's a new normal. It's never going to be the way it was before. Never again, the way you had before imagined that it would be. It's just a new and hopefully a better one, because you're appreciative to be alive and, hopefully getting well.